2. Sweet.
Hi, I'm Andres. This is my first semester as a full member of APTT.
I'm Madison. I'm one of the co-directors of external training with Jamie this year, and I use she, her pronouns.
Okay, so in today's session, we are basically just going to be covering just some essential skills in active listening. We're going to be doing some activities and like breakout sessions and stuff too. And because the session is really about listening, it's about body language. If possible, I'd really appreciate if you could turn on your video cameras for the session as well. That'd be really helpful. But so with that, let's get started. I'm gonna share my screen right now. There, does that work? Okay. So yep, we are a place to talk, and this is one of our empathetic listening training workshops that we offer to just like any campus organizations and student groups who request it. And so a place to talk is basically a peer listening organization. So we as members are trained in over 50 hours of active listening. We get mental health first aid certified. And basically we're trained to sit shifts on campus. So we're like stationed, well, this is like when it's not during a pandemic, but under normal circumstances, we sit shift in various rooms on campus. We have a room in Brody, and then normally in AMR1 and Woolman. But then during this semester, this year, we've transitioned to doing, to still offering APTT services, like peer listening services over Zoom. But I'll give you more information about that later on. Yeah, so we offer peer listening services. So one of our core tenets is to not give advice. We're just here to listen, here to help people explore their feelings and their thoughts, but we are not like certified therapists in any way. We don't tell people what to do, but we do refer people to resources if they need. So before we go into empathetic listening, I just want to share this really quick clip about what empathy looks like and how it compares to sympathy, because they're often confused with one another. You may have seen this video before. I feel like they play it in like some psych classes and stuff too, but anyway.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. at least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Okay, so as we saw in this video, empathy is really just about perspective taking, about sitting with somebody through their experiences and their emotions, not trying to silver line or like be like really optimistic about things, because somebody's going through something. Like, you have to let them express and explore those emotions. So just being able to sit with them through that discomfort and through their emotions is a really, really like important and crucial way of like listening and being empathetic and connecting with somebody. So we're just gonna do a quick little word cloud thing. If you could either scan this QR code or go to menti.com and then enter this code on the right. And then I'm gonna pull that thing up. Oops, this is not right. Here. Yeah, so please scan the QR code or enter the code here. And then I'll take you to this. And so I'd just like you to put in, I think you can put like 3 entries tops. But yeah, just like important skills that you think like a healthcare provider should have or demonstrate. Great. Patience, kindness, compassion, active listening, empathy, respect, honesty, selflessness. I like that. Great. These are really awesome words. Thank you for putting these all here. And I think that like there's some really key like recurring themes here, right? Like being non-judgmental, being empathetic, being compassionate. And these are all really key to facilitating good communication and a really good relationship like between the healthcare provider and the patient. And all these interpersonal skills are so important in healthcare settings. And personally, I don't think that they're emphasized enough a lot of the time, but super crucial. So just like keep these in mind as we proceed with like the next slides and as we talk about the active listening skills and how they can be applied to like healthcare settings and as you know, future healthcare providers as well. So I think Andres is leading the next question. I can go to the next slide. Up here.
Yeah, so we wanted to, bring up this question about and hear from y'all about when was the last time you felt heard, and feel free to drop a response. Being heard can come in different ways, so if you can, tell us more about it and elaborate on it, that would be great.
These don't have to be like very long or like fleshed out answers as well. Like I can give an example. Like I was on the phone yesterday and I was talking to my mom about like my summer plans, and um, normally I feel like I'm seeing responses already, but I'm gonna keep talking. Normally, like I feel like when I talk about like internships, she like stresses me out more. But this time she was like, I think she understood that I was just like really tired, and she just like let me talk and like didn't judge or like give advice or like tell me to look at this or do that, or like somebody else's kids was doing this, which made me felt heard, made me feel heard. Anyway, I see some responses now.
Thank you for sharing, Jamie. Yeah, these are some good responses right here. If at all possible, if anyone feels comfortable speaking up, it would be nice to hear what about that experience like made you feel heard. So like I see talking with my friends about school, like I see that as that's definitely a good thing, and I've definitely felt the same way whenever I talk to my friends. So could you elaborate more on what you mean? What about it made you feel heard? Whoever wrote that.
Yeah, that was me. So I'm a senior, so a lot of my friends are seniors, and we're all about to graduate. So it's just kind of like senioritis is hitting, and motivation is kind of low. So just like being able to talk with your friends and having them relate to you or just listen to you is really helpful and kind of motivates you to keep going.
Awesome. Thank you for sharing. And thank you all for sharing your responses. These are great. Yeah, like someone mentioned that whenever they tried without trying to silver line it, that's that's true. That's a good one. So before we delve into these skills, we wanted to talk more about what we shouldn't do as listeners. And as listeners, we want to open up the conversation and make a welcoming environment as much as possible. And this is already difficult through like Zoom setting and maybe texting or phone calls. So these communication blockers can be big reasons why people might want to shut down and end conversations, and this could lead to them being superficial. So here's some examples of things to avoid doing or saying. Don't judge or criticize. This could come, an example of this could be like you're being so dramatic, or you're such a pushover, and if I were you, I wouldn't have done that. Flat out agreeing. Uh, by this we mean, when someone shares something with you and an opinion, and they're like, and then you go and say, yeah, you're totally right. And this can be very, this can be a little hurting, especially when it's like a self-deprecating statement that they made, because it might amplify a feeling that they don't, that maybe they don't need to be feeling in that moment. Next is assuming. So you don't want to be like, I totally know what you mean. Uh, Whenever someone shares an experience with them, it can be minimizing, or it doesn't give them a chance to explain their experience to you. Analyzing, an example could be, I don't think that's what you mean. And basically, whenever you do something like that, it could like tell them how they feel or should feel. And you, as a listener, you kind of don't want to be the one amplifying feelings towards them. And dismissing or silver lining, this can come as an example. I'm sure you'll feel better tomorrow, or as the Renee Brown video said, at least this didn't happen, or at least X didn't happen. And this is again another invalidating thing and doesn't address what they are feeling in the moment. So now we're going to show you a quick video about what empathetic listening should look like.
Sorry, I didn't mean to stop sharing. I meant to switch tabs. I'm so incompetent. Oh, that's not what I meant to be sharing. Wow. Oh, there we go. What's happening? Sorry, guys. I'm really bad at this stuff. Okay.
No! No, 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 you can't take my rocket to the dumps, Riley! And I go to the moon! Riley can't be done with me.
Hey, it's gonna be okay. We can fix this. We just need to get back to headquarters. Which way to the train station?
I had a whole trip planned for us.
Hey, who's ticklish, huh? Here comes the tickle monster. Hey, Bing Bong, look at this. Oh, here's a fun game. You point to the train station and we all go there. Won't that be fun? Come on, let's go to the train station.
I'm sorry they took your rocket. They took something that you loved. It's gone. Forever.
Sadness. Don't make him feel worse.
Sorry.
It's all I had left of Riley.
I bet you and Riley had great adventures.
Oh, they were wonderful. Once we flew back in time, we had breakfast twice that day.
Sadness.
It sounds amazing. I bet Riley liked it.
Oh, she did. We were best friends.
Yeah, it's sad.
I'm okay now. Come on. The train station is this way.
So yeah, as you can see from that video, we could tell that there were two different types of responses to Bing Bong's uh, emotions. Joy was trying to fix, minimize, and dismiss them, basically trying to cheer up Bong's things, whereas sadness, literally sits with Bing Bong through the emotions and, is able to acknowledge their significance and, matches Bing Bong's tone. And she doesn't shy away from his sadness, which allows him to, feel validated and listened to. And, it allowed Bing Bong to compose himself and, advance the rest of the movie.
Yeah, and with that, we're going to move on to the empathetic listening skill set. So today we're going through 4 different skills. First is nonverbals. So nonverbals, does anybody know what these are? Or like, can you give an example? You can just pop it in the chat or something.
I guess one could be maybe like a hug, kind of like we saw in the video we just saw.
Mm-hmm. Yeah, definitely. Super, super important nonverbal. And then I see in the chat, facial expressions, eye contact, body expression. Exactly. Nodding to show you're listening. These are all great responses. Thank you. Yeah, and nonverbals are so key to indicating that you're listening, but they're so, I feel like not enough emphasis is put on them. So nonverbals, they demonstrate an active interest and help to facilitate engagement in your conversation or your interaction. It really shows that you're giving somebody your full attention. You're having an open and really welcoming posture. And another aspect of body language that is really important as a healthcare provider is to get on or below the patient level. It really, really changes the dynamic when you're looking down on somebody from above, if they're sat down or something. Maintaining good eye contact, nodding, using verbal affirmations like or yeah, just to indicate that you're following along. Mirroring the other person, so mirroring them in terms of body language and posture, but also in their tone as well and their expression. So obviously if they're really excited and animated, you should also reflect that and not just be deadpan. And also a really, really important nonverbal is embracing silences. So this is when you, after somebody has said something to you, you kind of give them, just pause for a moment and allow the person who's spoken to reflect on what they've said, but also allow you time to sort of absorb what they've said and formulate a response. It's actually a really, really crucial part of conversations that is often overlooked. And I found personally that silences are so important for when somebody's like talking about something and they like pause. If I like give them a moment before I jump in, often it's like they're just taking a pause and they're like, and then they continue what they were going to say. So if you don't embrace these silences, you're kind of inadvertently like interrupting at times. And that's something that like I didn't realize because I think that I like used to be so uncomfortable with with silences and like would always jump in. But yeah, nonverbals are really, really important, just to show that you're interested and you're engaged and that you care about the person. Like I have heard of many interactions with like healthcare providers where even just based on like their body language and facial expression, like the person was like really put off and didn't feel comfortable in that situation. So these are really key. And here we've highlighted a little like tiny task to try out embracing silences in your conversations and just like see, just like test them out and see how they feel.
Awesome. Yeah. So now we are going to move on to open-ended questions, the next skill. And before we start, can anyone tell me what the difference is between an open and a closed-ended question? You can feel free to drop it in the chat. Yep, that's exactly right. Yep, it's a closed-ended question is more of a yes or no thing, while open-ended provides more room for expanding. Exactly. So open-ended questions are great conversation starters in any situation. Open-ended questions allow the speaker to open up and further explore the topic that they are discussing with you or conversing with you. And unlike closed-ended questions, which guide the conversation to succinct, and they guide the conversation to succinct answers. So this will invite the speaker to direct the conversation to their own thoughts, concerns, and experiences. The difference between what, how, and where versus why. So we like to avoid questions that start with why, because it can incite a defensive response. Typically, it might sound a little too judgmental, like say you say, well, why did you do that? It might, put the blame on the speaker themselves and they might want to shut down if they hear why. So it's much better for you to work out open-ended questions that start with what, how, or where, and there are much gentler ways to explore that same idea. So maybe instead of saying, well, why did you do that? You can be like, how come you did that? Yeah. So here, again, open-ended questions are all situational and dependent on what the patient wants or needs, and you can use these to explore their feelings. These are a few examples that we have here. How has X been affecting you? Where do you think that's coming from? Could you tell me more about X? How are you feeling about X? And what makes you think that? These are just some examples of questions for when the conversation begins to progress a bit more. And, a good tip here for like, we use the word X here, but in a sense that could be like, you could basically ask a question about something that they've previously mentioned or previously said throughout your conversation. So that way you can, thoughtfully incorporate those things that you heard. So this is the open-ended questions exercise that we have for y'all. And again, drop it in the chat. Basically, how can we convert these not so good open-ended questions into something better? So why don't we start with, why did you do that?
And again, you can also think of like applying these questions to like the role of a healthcare provider, for example, like if somebody was like talking about some kind of like behavior or something that led to where they are now, like instead of asking why did you do that, like what could you say?
For the first one, like if a healthcare provider was to ask, like, why did you like why did you eat so much sugar, or why did you, have a certain habit or whatever. A better way to ask that or to approach that could be like, um, what is, I don't know, maybe like what is making you have that type of habit? What is making you, not get enough sleep, or what is making you eat that way, or something like that?
Yeah, awesome. Exactly. That's a really good, way to change that question. Okay, what about, let's see. Does anyone want to maybe change the next one? Did X help?
Yeah, sure. I'll do that one. So I guess if we're talking about like medication or some type of like recommendation that we gave, I'm still thinking in like the healthcare provider like sense. We can be like, have you noticed any changes in your behavior or a symptom?
Yeah, that's good. That's good too. Awesome. And what about the third one? Is that a problem?
Going based off of the healthcare thing, if it's like a change that's happening, can you, like, how does that make you feel, or what do you think about that?
Yeah, perfect.
Yeah, definitely. I think like really emphasizing like how something is affecting them, how it's making them feel is so important. Like same with the like did X help question. I think it was Tempest. I think you responded to that one. Yeah, that's really great. Like really focusing on like how like this type of medication is affecting them. Because if you ask somebody like, did taking this medication help? It's just like yes or no. It can also, they might just be more inclined to just like agree just because it's like easier to. Whereas if you say like, oh, so like how did it feel to be on that medication? Like how did that affect you? That really allows them to really talk about, and like that also gives you a better understanding too as the provider. Okay, so next I am going to talk about feelings. Feelings are super, super crucial in any interaction, but I think also in like this, especially in sort of healthcare settings, in facilitating like really strong relationships. Like in the word cloud that you all responded to, you all talked about like compassion, kindness, patience, like all of these things are so important in being an effective healthcare provider, and that just doesn't affect your relationship, but that also affects outcomes. Like it's been proven that like strong relationships and trusting relationships lead to far better health outcomes. um, so feelings, we've kind of already touched on this with like open-ended questions as well, so it might feel a little bit repetitive, but how do you feel right now? How's that affecting you? Really, really focusing on the feelings and how things are affecting them will give you a lot more information than asking questions like, oh, did that thing help, or is that a big problem? And also picking up on words that may feel like quite vague or that are quite emotive or might be suggestive of other underlying things. So if somebody's like, oh, I feel really bad, you can say like, oh, bad, how? Or if they say like, I've been feeling really off or really unwell, you can say like, oh, like off or unwell, how? So you're really, really honing in on those vague words, and allowing them to elaborate, but also reflecting them back upon the person so that they can sort of think more deeply, like, okay, like I've been saying I've been feeling bad. Like, what is that? Is that like I've been feeling depressed, or is it like I have had a headache, or like something else? So now we're going to go into breakout rooms. We have 3 APT tiers here. So you're going to be in one of our 3 rooms. And so just like practice using the 3 skills that we've covered so far. We have 2 scenarios here. So the first is about a patient who's refusing care. And so how can you help them to talk about that and like explore that, and just like navigate that. And then another one is delivering news about a chronic condition to a patient's parent. The patient is a child, and so you're just talking to the parent. The parent's like expressing their worries and anxieties for their child's health and their future. What kind of things could you say in the conversation? How could you approach it? What would you really, really focus on in terms of both your nonverbals and the kind of questions and things that you say in those conversations? So I'm now going to assign these breakout rooms. Hold on. It's going to take me a sec. But in the meantime, are there any questions about any of the things we've talked about? Okay. Wow, I really can't count these days. We have 18 people, okay. Okay, so if you don't receive an invite to a breakout room, that means you're with me in the main room. So I'm gonna assign them now. Oh, and Madison and Andres, I'll send you in the chat the prompts, just as reminders. Hello.
Hi.
Hi.
How are you all?
Pretty good, pretty good. Oh, I was gonna say actually, but I'm sorry, I feel like I'm talking too much, so if anybody interrupt me. But I really like the video we watched with the sympathy versus empathy. I feel like people can often like confuse the two and feel like they're being empathetic when in reality they're just being sympathetic. And I feel like empathy emphasizes like a connection, like a personal connection with whoever you're listening to or communicating with. So I really like that video because it's very informational.
Great. I'm glad you liked it. Yeah, and I definitely, I mean, I had similar reactions too after watching it. And also it's like I realized that I think I was just like, I mean, I still am like uncomfortable with like feeling sometimes. And so like when somebody like expresses something that they're dealing with, I'm like, I always jump to like, oh, like at least like, you know, it could be so much worse, right? Like, and I think that I'm like helping. But like, I know that when somebody does that to me, I'm like, no, like that's not helpful to me. Like that's not even relevant to my situation. So I'm glad you enjoyed that video. It's a classic in the active listening stuff. Okay, so I think we're gonna talk about, I need to keep an eye on the time though. Okay, we'll just have a couple minutes to talk about the prompts. So the first one is about refusing care. So you have a patient who is just like, who just doesn't want to get like whatever treatment. It's like, what kind of things could you say or do? And also what would you not do?
I guess what you would not want to do is say like why, don't use the word why and say like why are you refusing care? And instead like use like other question words like what makes you not want to get this type of care. Yeah.
Like maybe asking what they would prefer instead, like figure out what they want. If it's like not the care, like what's stopping them from wanting the care.
Yeah, those are both great responses. Definitely, like I think especially asking why from a position of power and like perceived authority, both like in terms of like your position, but also like knowledge. I think like asking why can like seem like you're like judging them and like saying like you have your own perception of what's like right or wrong in medicine, you know, like saying like somebody gave an example earlier, like, well, why did you eat so much sugar? Like that really comes from a place of judgment. So definitely like asking like the what questions. And Selma, I'm sorry if I'm saying your name wrong, but yeah, saying things like what's stopping you, like how can I help, what can be changed, those are really, really great questions as well.
I feel like I get kind of, it feels like complicated because if I'm a healthcare provider and someone's refusing treatment, I would want to like tell them every like all the possibilities so that they're just aware of everything. But I feel like if I were to tell them like the bad things that could happen if they continue to refuse treatment, like that could come off as judgmental or like um threatening. I don't know if that's the right word. Like, oh, if you don't do this, like this is what could happen to you. So I don't know how to like make that more understanding manner.
Yeah, that's definitely a great point too. And I think that that's such a challenge that a lot of doctors do face and have faced. Um, but I think that a lot of it is about like how you communicate and how you deliver it, right? Like if you're from a place of just like, this is all the information that we have about this treatment and like this is the reality, like being really honest as well about it. Like, yeah, like in some cases, like people have responded in like negative ways to this treatment, or like these are some like possible side effects, like all of these things, just like being completely honest, but not being like, oh, like it's, I just realized I'm completely flipping what you just said. But because you were saying like if you don't get the treatment, but also like, yeah, like completely like if you say it just like in an open and honest way, like this is what could happen, like this is the condition that you have, and like this is like the type of treatment that like is normally is like typically required to like address these things, versus like, oh, like why would you refuse care, like it's, I don't know, like just coming from a place of judgment. I think like there's a huge difference in how you can approach it and how you can express yourself and communicate. I don't know if that was a helpful answer at all.
That was helpful.
Okay, I think that we should get everybody back though, just because we're a bit tight on time. But thank you so much for participating, and I hope that it was helpful. I'm sorry we didn't get to the other prompt. But we'll also have like a breakout room thing at the end if you would like to return to any of the scenarios. Okay, I think people should be coming back soon.
I feel like that first question is really relevant, especially with like vaccine hesitancy, because I've had a lot of conversations with people that just like don't want to get the vaccine. So what I just like, I don't know, because I'm in a class where we're talking about like vaccines and how they work and stuff. So I've just like been explaining it, but I don't know how to explain it without coming off as like, I know everything, like I'm like better than them, or I'm just like calling them ignorant or something. Like, I don't know. It probably doesn't sound like that when I say it, but that's just something I think of. I'm just like, oh, I hope they don't think like I'm putting them down or something.
Yeah, no, that's a good point. And I think that like the fact that you're already thinking about these questions though is like a huge part of it. Like it's all about like the intentionality of it. And I think that in like medicine and in public health, there's such a tradition of like paternalism, and just like what you just said, like being like, okay, well, like I'm like, this is like the science, this is the fact, and like you're wrong if you like don't get vaccinated or something like that. I think like that is not helpful at all. But yeah, sorry. Hi everybody. We're talking about vaccine hesitancy and refusing care. But anyway, I hope that was helpful. I am gonna share my screen again and Andres is going to share the next skill. Let me just, too many tabs open. Here we go.
So yeah, the next skill we will be covering is paraphrasing, and in a way, this is an all-encompassing skill from the things that we've learned so far. So yeah, paraphrasing. One thing to note here is not interpreting. It is merely just reflecting back to the individual what it is you are hearing from them. You can consider it like a concise summary, right? So a good thing about paraphrasing when you're doing a paraphrase, don't be afraid to ask for clarification. So maybe you're, summarizing how the events unfolded so that you can know that you got everything right. And you might want to, so the speaker will appreciate that you ask for clarification and they want you to get it right, right? They want to know that you're listening. So leave yourself room for error, if at all. No one listens perfectly, so you got to give the speaker space to correct your understanding. So saying things like, again, correct me if I'm wrong, but it seems like, and then move on to the summary that you're trying to make. Or after the summary, you can be like, is that right? Am I correct with saying that? And these are just good ways to allow for that clarification that we were mentioning. Really easy way to show that you're paying attention and trying to understand in order to stay on the same page as paraphrasing. And you want to be able to use phrases like it sounds like, it seems like, what I'm hearing is, and you mentioned. You mentioned works well when you want to when you maybe you're hearing a conversation and you hear them say a feeling word like I'm feeling nervous today, I'm feeling upset. You can bookmark that feeling. So that means retaining it for a future question, and you can, elaborate on it with like a paraphrase question, like when you say, you mentioned that you're feeling nervous because of XYZ. Is that correct? And, a good thing to keep in note here is you want to keep these paraphrases concise and generally focus on the feeling. So you want to keep it as short as possible. As that can also be applied to open-ended questions. You don't want to make them drag out too long, and they're helpful to use if you ever want to check your understanding of a situation. Okay, this is the role player. Okay, so now we're gonna go into breakout rooms one more time for a little bit longer of a session, and basically, they're gonna be groups of 2 or 3, Jamie.
No, actually, everybody's going to be in
Yeah,
pairs.
so pairs. So everyone's going to be in pairs, and basically what's going to happen is you're going to one of you will be tasked with listening and one of you will be tasked with speaking. Basically, the speaker is going to be adapting to a role play as of and portraying a character. This character in specific is going to be a college athlete with a broken femur, and basically the speaker has just gotten out of surgery, and the listener, which will be the doctor, is coming to check up on them. So the listener just basically has to listen to what the speaker is saying, and the speaker is going to have certain things about them, like they're going to be depressed and anxious about recovery in the future. So the speaker just makes sure to elaborate on those feelings specifically. And other things you can say are, they're worried about their futures, like missing out on practice in the next season, letting himself and his parents down, and also keep a note that he is in physical pain still. So these are all good things that the speaker, whoever one of you is tasked with being the speaker, could mention in the role play. And the listener just has to use all the skills that we've brought up.
Yeah. Guys, this is like a role play, so really like channel those acting skills. But yeah, okay, I'm gonna put you all in pairs. Yeah, and I'm gonna be bouncing around the rooms too, so just to check in to see if like people have any questions or anything like that. But yeah, okay, I'm gonna open all the rooms now. Wow.
Oh, is this our room?
Yeah, our room. Oh wait, there's a room with only one person. What's happening here? Okay, wait. Let me move this person. Sorry. Okay, this should be good. Were those instructions clear, do you think? Do you think I need to check up on people? Okay, so do you two want to do your role play?
Do we have like a scenario, or are we like, do we have creative control of that?
Yeah. So one of you is like the patient. You're like an athlete, broken femur in the hospital. Yeah, just like sad and anxious and feeling, I don't know, just like missing school and like the season and everything, and like not sure if you can like go back, all of that.
Maybe out. Which one do you want to be, the doctor or the athlete?
I think being the patient, I'll be the patient.
Okay. Okay, I'll just start from the beginning. So, what brings you into Chioma? Okay.
Chioma, did you leave your room?
Yeah. Yeah. I can't actually.
Do you want me to put you in a room?
Actually, can I not be put in a room?
Okay. Do you want to like observe this one?
Yeah.
Okay, sure.
Okay. So what brings you in today?
I just had surgery and I'm worried that I'm not gonna be able to play, I'll say basketball. I'm worried I'm not gonna be able to play basketball for the rest of the season, or maybe for the rest of my life. I don't know.
I wish I knew more about female injuries right now. Well, if you keep up with your medical and physical therapy, I don't. I feel like this requires like a lot of thought and like. But let's pretend what I'm saying is right. Let's just pretend what I'm saying is right. Oh well, that's understandable. I understand how important basketball is to you. If you keep up with the physical therapy and the medication, I'm not sure you'll be back this season, but maybe next season you'll be fully recovered, and maybe this won't be as I'm sorry, I don't say that. Maybe this won't be as detrimental.
Yeah, but I don't know. I'm worried that like I might lose my scholarship as a result of like my injury. So yeah, so how quickly can I get better?
Usually, I feel like the recuperation time is a few months, but for you, we're gonna put you on a 4-month plan, and we can, if we need any documentation from us to get to the school, we can provide that for you as well. Yeah, but we are here for you as your providers.
You did a good job, Tempest. I was trying to switch it up on you.
I'm literally random things. Oh my gosh. Jade, are you out of your room?
Yeah, I think my partner couldn't come off mute or something, so yeah.
Do you guys want to keep going, or guess I don't have to? Because I know it's like nearing time.
I don't know what else to say. I don't know what else to say.
Okay, let's say, oh, sorry.
I can go. I think I know how I could keep it going.
Be empathic. Be like so bummed out about the season and like sad and angry.
Yeah, but like my leg will get better in 4 months, but like it's just been very upsetting. Like it feels like I'm gonna be losing my scholarship, so financial aid is at stake. I'm not gonna be able to be surrounded with my friends, like my only friends who I played basketball like with. I'm just not gonna have that community anymore. It's so overwhelming. I don't know.
Yeah, I'm sorry. I know basketball is really important to you. Maybe your team could let you, like, you won't dress out for games, but you'll always be there to support your team. I'm sure they would love to have you on the court during games, helping with plays, maybe help the coach. And as far as your scholarship goes, I don't know the terms of it, but I'm sure injuries, oh, I don't want to say that. Injuries are common, so I'm sure they won't kick you out. And you will still have a community to support you. You have us at our office, you have family, you have your team. And we'll get through this all together.
Thank you.
I'm gonna call everybody back. But yeah, no, that was good. That was good. Tempest, I think you could have asked like more questions though before being like, I'm sure everything will be fine. You know what I mean? But I think that you had like a very, very good like tone. It was very like kind and caring, and like I think like you were really like you had a really calming presence, which was nice. Okay, I think this is everybody. I know we're coming up on the time, so I'm just gonna go through some resources really quickly. But I hope that the role play was helpful, or that you learned something, and that you got some practice. Okay, just some really quick resources. So I talked a bit about our virtual room. So A Place to Talk has a virtual Zoom room, and you can access our schedule on Blackboard and our link. You can also scan the QR code here to access everything. But yeah, it's just like a space, like a Zoom room for you to come talk to any of our trained listeners about like absolutely anything at all. It's all confidential. And like we're here for the Hopkins students. Like that's why we exist, to just listen and support people in any way we can. We also refer people to like we refer people to like resources at the counseling center if needed, like all of these things. So come check us out. And then other mental health resources available to Hopkins students. There's the counseling center, of course. You schedule by calling their number. You can find it online. Timely MD is this like telehealth that is available to Hopkins students. So there's like Talk Now, and like you can also schedule counseling. So I feel like people don't know, like this isn't like well known enough, like among Hopkins students, but this is like free therapy. And like in the real world, therapy is like but expensive. So like it's so nice to have this and be able to access this. So I mean, I'm graduating and I'm like, I should have made good use of these resources while I was here. So just putting it out there, you should make use of the resources and refer people to the resources as well, because they're there and they're free for Hopkins students. There's the Calm app. It's like this like a meditation and like mindfulness app. And as Hopkins students, we get the premium version. So if you sign up with your Hopkins ID, you get like access to like all the stuff for like a full year and stuff. Yeah, I love it. I use it every night before I sleep. They have like a 10-minute, it's called the Daily Calm, and I listen to it, and like I kid you not, like it's helped my sleep so much. And I used to hate meditation, so just saying. And then there's Silver Cloud. It's this like online, they have like online modules, and it's like based on CBT, cognitive behavioral therapy. And yeah, you can like sign up and they like do different modules. There's like modules like anxiety and depression, and you like learn about it, and there's like activities and stuff. It's pretty cool. It's like basically like an online class, but it's like highly reflective, and you can yeah, you can just like fill out like all these like journals and stuff and like reflect on your own experiences. I really enjoyed that. And then the stress and depression questionnaire is like this questionnaire that you can find. I think it's on the Madison. Is this on like the counseling center website?
Yeah. Yes.
Yeah. So you access this questionnaire and you basically like fill it out, and they'll send you like a response about like the resources that are available to you and like what can help you out. So that's also really, really helpful, especially if you're not sure what you need or like what is available to you. So yeah, these are just some of the mental health resources that are available on campus. So make use of them if you need, and refer people if they need help as well. So yeah, just important and useful. But yeah, just a reminder about the tiny tasks. The first one is about embracing silences. Just try out in your conversation. It might feel a bit unnatural at first, but just kind of observing how the speaker responds to it, and how you feel as well. And then tiny task 2 is just paraphrasing. So just try out, just like, paraphrasing what somebody has said to you, being like, oh, you mentioned this, like, can you tell me more? Or it sounds like you are feeling quite overwhelmed at the moment, stuff like that. And again, this is just like practice, just to see how you can use those skills, because everybody listens in their own way. Like everybody has their own listening style, and yeah, it's all about finding your own, like finding what works for you. And that's it. If you have any questions, you can ask me now, or you can also email externaltraining@gmail.com, apttexternaltraining@gmail.com. And you can also request this workshop or like other workshops from APTT. We offer these workshops to like just any organization that asks for them. So yeah, or if you just want to learn more about ABTT in general. That's everything. And yeah, thank you so much. I really enjoyed this and I hope you did too, and that you took some stuff away from it. Yeah.